My name's Arthur Yarbrough. I'm a social worker, an LCSW here, SimHip. I work on the social learning program unit. And our main objective is to get people prepared for life outside of the hospital. And so we do a lot of coaching in regards to hygiene, a lot of coaching in regards to the importance of taking your meds, a lot of coaching on relating with other people. So it's something that we feel fits just about all of our patients, but we've been able to do, I think, some pretty good work with some very difficult patients to get them to that point that they're ready to be out of the hospital. That's what we do at SLP. Things that I like about that are beginning to change here is I've only worked here for about 7 years, but I'm a lifelong Puebloan. I had an aunt that retired from the hospital. I've had 4 of really good friends, their parents retired from the hospital. And so I don't believe I know the complete history of the hospital, but the hospital used to be a really good place to come and work and to build a retirement. People came to the hospital and worked 20, 30 years and left feeling that they'd accomplished a lot of things. I think we're headed back down that path because it wasn't that way about 5 years ago. It was really 5 years ago, I was about 2 years in and I wasn't sure I was going to stay. But here in the last couple of years, there have been a lot of things. I think the management at the hospital listens to people now. I think they're committed to making changes. And I think that's trickled down to the units too. Listen, you heard Andre talk about the staffing and all of that, and you probably heard that a couple of times today. And yeah, staffing is a huge problem for us. It's just, I don't know of any of the units that couldn't use an extra social worker, just in the context of being able to help get people out. We could add to more treatment, true, but we could also be able to get people out sooner. One of the things that Andre was talking about was resources out in the community. It's been about 3 months ago, but one of my clients was going to have to wait almost 2 weeks before they could get in to an intake appointment at a mental health center. And that's not soon enough. I know the importance of people getting in to see at least a clinician and hopefully a prescriber early on, because I worked at a mental health center for about 10 years. And if you don't have contact with that person first 5 to 7 days, you may not see him at that intake appointment. If you don't get them in to see somebody who's going to help them stay on their medications, they're not going to be successful at it. But I don't know that this group has any control over that or can work on some of that. Just having them take people in to see somebody within 7 days, and maybe get at least a prescriber to see them in a timely fashion.
We have about 1 minute left.
Okay. I guess the last thing I would say is that there needs to be a better integration between mental health and substance abuse. I would really like to be able to get a patient ready to leave the hospital, go into a substance abuse program that's paid for, and for that person to do a month or 2 months of that program and come out of that program with his benefits and stuff intact and a place to live. I think that would make a really big difference in people being successful in leaving this hospital. Substance abuse, along with homelessness, are all intertwined, and if you don't address those things, they usually survive a month or two, and then they're back in trouble again. So, I think I used up my time.
Can I ask a couple of questions?
Mm-hmm.
One, when you're talking, I understand taking a while to get into the mental health centers. In the previous job, I dealt with that significantly and tried to do something about it. But is part of the issue here because they are leaving and they've been here so long that they've lost their Medicaid, so you're then trying to get them eligible and you can't make an appointment for them until they've got their Medicaid?
Well,
help me understand that a little bit.
The day a person leaves our unit, we take them to Social Security and initiate them getting back their benefits. Most of the time, we've already done that and got them awarded Social Security benefits, but we have to take them to Social Security that day to start the process for them to be in pay in about a month or a month and a half. We also try to get them their Medicaid started, but it doesn't populate into the Medicaid system sometimes for 2 weeks. And mental health centers are reluctant to do anything about that. Even though we can show them a awards letter, tell them that we have a technician call them and tell them that yes, they've been in and started the process, and they know that this process takes about 2 to 3 weeks, they are at times reluctant to, because from what I gather, in the past, they, like some placements and stuff like that, have gotten burned when the Medicaid didn't go all the way through. But that's a process that I think we could make better. I think it's a process that, that we could say, okay, we've done this, this, and this. Please accept them. Please treat them as if this is going to go through. I know that they can back bill for 3 months on Medicaid, but
Depends on the Medicaid.
yeah.
Depends on the rate. 60 or 90 days.
Okay, but it's a lot of times they're just reluctant to do it.